Uh, Thanks everyone for joining us this evening to talk about a relatively new program that we're running here at Western. I know some of the folks on the call tonight have been through the process with us. Um, and I think probably the easiest way is to do a quick presentation to tell a little bit more about what the program's about in the sport and exercise medicine side of things, and then we'll take some questions. So this program's been in its fifth year now. Um, this year we have a mix of six physios and eight physicians in the class, and I thought maybe if we'll just back up and we'll talk a little bit about the origins of the program and who we are as far as instructors and what our philosophy is. Um, my role is sort of twofold. I'm a physiotherapist by trade. Um, I've worked in a number of capacities at the Fowler Kennedy Clinic for since 1999, and you can see that I've had various experiences now that I'm older, even taping my dog at the cottage. But part of the Fowler Kennedy Clinic is revolves around our fellowships of physiotherapy, sport and exercise medicine, and orthopedics from around the world. I think I've been involved with 220 fellows in my career at the last count. Um, and we certainly appreciate the interactive and implicit learning between the professions. In 2019, some of my time was uh, seconded by the physiotherapy school to write some sport and exercise medicine content and look at opportunities for education. And through that process over a year, continually what came back to us was a lack of multidisciplinary learning at a master's level in sport medicine for busy working professionals, people that aren't able to commit to a fellowship, but would still like to develop competencies in sport and exercise medicine. Um, that's sort of resulted in us trying to get a core number of instructors that are balanced between physiotherapy and on the physician side. And you'll see Caitlin Madigan, who's a physiotherapist, Steve DeChacco is a physiotherapist, Danielle Calton and Steve Joseph, both physicians that work with NSOs and are emerged physicians as well. So they have a very good complementary skill. So those are some of our base instructors. When we designed the program, we wanted to design something for people that wanted to work in an elite level sport, but not only in elite level sport for the few that are going to the Olympics, every few years, but also to help the Sunday morning running group, the local high school rugby club, and through pediatric to older adult. And we've got competencies in all of those in the sport medicine aspect. We want to do it through a lens of from the physiotherapy profession, primary care, sport and exercise medicine, orthopedics, and other experts in the field. And one of the things we really wanted to do was primary source our information based in evidence, but also through a lens of practical people that work in those spaces every single day and get those clinical pearls, clinical patterns, and start to develop some very direct teaching from specialists that we may not otherwise have access to. If you've been on the website at all, you'll see there's an umbrella of sport and exercise medicine courses. Sport and exercise medicine is the only one where physicians and physios train together. There is some shared courses across those multiple courses or multiple fields for research methods, professional practice, et cetera. But the two courses that are field specific, they're kind of broken into half year in the fall and then in the after Christmas. We follow like anatomical geography to help guide the topics, but it's not all sort of MSK. And if I use hip, for example, we'll certainly have experts come in, orthopedic surgeons that work in those spaces and are doing research to talk about FAI, certainly OA, um, femoral neck stress fractures, compression versus tension sided, but we'll also pause there and look into the metabolic aspects of this with relationships with food, red S competencies, et cetera. So you'll often will pause and um, do a number of topics, not unlike after Christmas when we start sort of at the head and neck. We'll certainly do our C-spine trauma and emergency, but we'll also talk about we have people in to do our concussions. So our pediatric concussion is done by our past CASM president, Laura Purcell. And our adult concussion is done by Catherine Schneider at the University of Calgary. And then Ali Rushton, who's led the consensus on vascular injuries, will do our session with respect to that. So, like I say, it does follow regional patterns, but there's often offshoots where we pause for a while and cover off some other competencies. No matter what profession you're in, whether it's physicians or physios, there's pillars of advanced practice. And some of you probably have read some changes that are happening around the world. People, different professions working together to fill different roles and provide access. Stefania and I were just at the CASM conference, and they were looking at different models provide access on the East Coast last year. There's a lot of this innovative talk, but essentially, these are what we're trying to develop. Wherever you're at in these pillars is to try to move you forward based on what your needs are. And the way we sort of get at that is with an adult learning contract. As you could imagine in this type of program with busy practicing professionals coming in, each person may have different needs. Some people have been to 4 Olympics, don't need another tracksuit or any more time on the field, and they're looking at mentorship in policy development, or maybe perhaps their mentorship is with an MBA or other groups. Other people may want to teach or work in parts of governance in sport. There's other earlier career people that really want to commit to some of those types of skills, or whether it's diagnostic ultrasound injection workshops, those types of things. So we try to allow some customizability in what we're pairing your mentorship experiences and clinical experiences with, because we do have placements at the Fowler Kennedy Clinic during this time. So the delivery method, and we debated this quite a bit, and I think we've got the mix right. When we think about practically applied clinical sport medicine, we picked Monday nights from 6:30 to 8:30 p.m. to try to give flexibility to time zones. But with most sports, whether it's varsity, professional, or recreational, Monday nights seem to be a time where people can get some bandwidth to jump online. So our sessions every Monday night are very interactive. They're not very often didactic. Often it's breakout groups. Often it's case presentations or interactive sessions with multidisciplinary groups, and then having the experts in the field, whether it's ENT, dental, et cetera, come back together and sort of work through those learning competencies. The asynchronous part is usually the prep prior to the synchronous session that week. And then when we get together twice a year in London for a couple of weeks at a time, we sort of put the practical side or any of those cross-cutting themes you'll see carried forward to a number of our sessions. This is a dashboard of what you'll see. I don't want busy professionals trying to figure out where things are supposed to be. When you log in, you'll see a checklist of what you're supposed to do each week, the learning outcomes. I'll usually do a little talk about what we're trying to achieve this week. And then often I do a little wrap-up talk if there was outstanding questions or or issues that we wanted to kind of put a bow on before we move on. But all your resources, asynchronous podcasts, videos, everything is in this one page. So to try to make it as easy as possible. I just took a snippet of some of the people that we have from one term this year. Come and do some speaking. You'll recognize some familiar faces. But I think the strength of the program uh, certainly isn't listening to me drone on all the time. It's about the people that we bring in and really try to give, like I say, a first person experiential perspective on what the best clinical practices are. When we're on site, that's usually fun. Anyone who's done an online course knows that if you get an opportunity to actually meet the class and spend some social time together. So we go to the Fowler Kennedy Clinic and do a number of things. We spend some time in the biomechanics labs, the exercise physiology labs as well. Um, we're certainly not trying to create exercise physiologists or with this degree, but we're trying to give you an experience in the terminology to understand and synthesize information, or if you're on an IST or putting teams together, that you understand the competencies that you should be looking for, and where there is resources to do a little bit more in depth if you wish. So we've got those types of modules. Whoops. And like I say, well, our exercise physiology labs, we also do get the old bench press in there. And we do a lot of equipment removal, equipment fitting. We have modules. We've tried to put a little library together for people that if you're not familiar with, say, speed skating or bobsleigh, you can pick and choose some of those things if you happen to be spending or volunteering at an event and you're not familiar with the sport. That's been popular as well. Uh, Taping, wrapping, anyone that are interested on the physician or physio side in doing that, we certainly have the capacity for that. Other people want certain aspects of that on the medical side if they're sole charge with some smaller teams sometimes. Um, so that's a bit of a choose your own adventure depending on how much or how little you want to do that. And this is one of our diagnostic ultrasound workshops. It's even though the physios aren't injecting, it's the clinical reasoning. This is all case-based. So we spend the day going through different areas of the body, talk about different injectables, whether it's PRP, visco, corticosteroid, pros and cons, what the temporal sequencing of clinical best practice may be, and what sort of the white paper messaging is on these types of things. The other thing that we do really well in this program is helping understand clinical pattern recognition of injuries. And we do that with a number of experts that we bring in that work in the fields. And at the Fowler Kennedy Clinic, we've created an acute injuries clinic that we've put about 7,000 people through now since 2022. And it's a combination of physio and physician partners that try to have about a 15-minute visit, plus or minus, depending if you have an X-ray or need an X-ray, but really to get a plan, to get imaging, to get a referral, note for the coach, because in London especially, there's a huge shortage. I think in Canada right now, 30% of people don't have family physicians, and as you know, emerge departments are overworked and under-resourced, and rather than waiting 8 hours for a negative X-ray with an ACL injury, actually coming to a clinic for a focused tactical examination to get a plan together has been proven to be very popular and good for patient outcomes, patient satisfaction, as well as appropriate resource allocation. And this is, these are just a few cases that come through on a day-to-day basis. Our model, some days we're seeing up to 30 people a day, and that's not even on full days, but we're having a very large appetite of physician and physio pairs from smaller communities that may not have access to experts to come and spend some time in these clinics and roll out models in different provinces. Um, so I struggle sometimes. Did we name this course appropriately with sport and exercise medicine? Because I think the skills go beyond that. We certainly, for example, in the exercise physiology labs, we want you to learn the things that you can do when you have no budget, but we also want you to know what a beep test might be able to do for your local high school. And if you're involved in any type of planning or periodization or evaluation of those teams, that you can slide your knowledge scale to the appropriate amount of resourcing and extract or provide information that's relatively appropriate. But it doesn't matter if you're on the hardwood or in the clinic. Common things are common. Epidemiology doesn't lie. Foosh injuries happen on whether it's on the pickleball court or on the sidewalk on Sunday morning when people are out for a run. So a lot of, even though it's contextually a bit different in different venues, the clinical pattern recognition, the focused physical exam and clinical management algorithms are all very, very similar. So even though a lot of people in that are alumni work, with teams but I'd say a vast majority of our group travel periodically with events and teams, but also have a strong clinical practice where they're finding these skills in helpful in rounding that out. And this is just, again, another example of some people that we see in our acute injuries clinic. Depending on what your experience level is with sport, some people want to diversify, maybe get some exposure to contact sport or some sports maybe they don't have where they live. We can provide that. Certainly on the Fanshawe campus, we have 300 varsity athletes. Western, we have over 1,300 varsity athletes. I think we have 38 or 39 varsity teams plus club teams. So often people will come in even a little early sometimes to spend some time with our groups if that's something they want in their portfolio. And I've just created a few slides of some of our alumni. You may see some familiar faces. We've been lucky to retain a number of these folks at Fanshawe or at Fowler Kennedy. But pretty much coast to coast, we have physicians and physios now that are working in different spaces, traveling around, starting their careers, and always are kind to send photos back so we can live vicariously through some of their travel experiences. So these are just some of the recent alumni. So we're 5 years in now into the program, and I think we're finding that right mix of physios and physicians. And last slide is about when you physically would come to London. And up until this year, we used to come 3 times a year to London for 2 weeks at a time. And this year, we've decided with some focus groups from previous alumni, we're going to go 2 weeks, longer days through the weekends without losing much competency development. And the reason that we did that is we're committed to accessibility. And we found, especially some of our emerge physicians that work in places like Moose Jaw and around the country, it's really, really difficult, almost impossible for them to leave their post for 6 weeks at a time and get coverage remotely. And with the cost of travel, and losing clinical time, this is where we've landed. So we're giving this a try for a couple of years, and then we'll sort of revisit. But halfway through the first year of this, it's seemed like it's relatively popular. Unfortunately, our second residency partially covers into the FIFA World Cup, so a couple people had to reschedule some of the tickets. So I'm not very popular with that, but anyway, hopefully that answered some questions. I don't know, Stefania, if you want to sort of speak to your experiences here prior to the SEM coming on board?
Yeah, sure. Um, I did it partly because it was so available, although I was working full time and also working part time with sport at that period. The on-site visits were great. You got to meet your classmates and everything. The quality of education was excellent. And then the online portion was very, you know, well constructed, easy to follow, and you could really self-pace according to your schedule, with work and everything. So I was really quite happy with the whole process. I'm sure it's even gotten better from that point, but I found it to be excellent back then. I don't know if Marilyn's available to say anything, but my one of my biggest things from a personal perspective was the ability to keep working and not feel like I was getting buried by everything.
Hi guys. Hi everyone. I'm Marilyn Adams. I currently work with the Spurs and I'm actually in the middle of treatments right now. So I apologize if I'm sweaty. um, but yeah, so I've been with the Spurs for 12 seasons and Stefania was with Brooklyn Nets for 8, I believe. So both of us are originally Canadian. So I think some people maybe are on the call that might be from the US. And just to clarify, London is London, Ontario, not London, England. So you don't get to go to London for the residency
Yeah.
or the on-site part. Um, but yeah, it was really, I started doing the program at Western, like after I've been working for, I think close to 30 years now. So probably at about 10 years ago, I did the clinical masters in manual manipulative therapy through Western because it sort of filled a void that I had for some of the credentials I had, but I didn't get an actual university master's. So that allowed me to actually get the master's, legitly through a university. And I did it while I was working at the Spurs. So I found time, like our days are busy, but there's always time. And it was hugely helpful to be in a cohort of people who were growth minded and wanting to push forward and learn more. So that was really great. And I've developed friendships that I've kept, from that time. And then the program now, when Greg started it, he asked me to come in and lecture a couple of times. Stefania's also done the same for the cohorts, just to bring in some of my experience from the Spurs. And I think every year my talks are different because we keep growing and we keep changing. So, I can't say more about spending money and investing in yourself for growth. Like, I believe that's way more valuable than any handbag I could buy or something like that. So I'm a believer. So you're gonna ask me if anything's worth it for our education and and all that. I truly believe it is, and I believe that's what got me to where I am now. And I keep signing up for courses. And Stefania's probably on her third or fourth master's now. I think I've done two, and there's just it never ends. So yeah. So if anyone has any questions, let me know. I'm going to go off camera again, but I'm glad everyone could show up and hear about it. And Greg's very open to answering questions as well.
Um, I think the other thing, Stefania, we were chatting before, we have had our first international physician this year, especially people that have come to London to do orthopedic fellowships and gone home to their country of origin are considering sending some of their physicians and physios as well, just so they have sort of common jumping off point. Um, the other relationships we have with Sport Physiotherapy Canada for the people that are in Canada, if you do our course, you don't have to do the online modules or the MCQs. We keep track of the hours for mentorship in the portfolio exactly the same as Sport Physiotherapy Canada. So you can challenge those exams if that's something that you're interested in doing. On the Chasm, on the physician side, we have a relationship with Chasm that our group gets to share resources on the Tuesday night sessions with all the fellowship programs in Canada, and they have access to training materials, etc. They want their practice eligible physicians to be successful, and a lot of people that aren't able to do a fellowship because they are practicing clinically are choosing this path as well. So that may or may not be applicable to people on the call, but just as a brief description.
And thank you for your time. I think there's a huge window for programs like this because I would say that one thing for me before I started working in pro sport, um, and not like even the NHL before I worked in the NBA, you know your lane and you learn your lane so well. And if you had the good luck of working on some sort of performance team with a sport, you were exposed to other disciplines. But sometimes you come from like a clinical setting where you really focus on your skill set within that lane. But having this type of exposure and breadth of training across disciplines as well, and understanding the language that your future colleagues will be speaking, even if you're saying the same thing, sometimes it's not getting communicated efficiently because you're using different language for it. So, I think this is a great way to learn common language, and it's a good step, and a confidence builder too for stepping it up in sport. So
Yeah, and maybe I could just add in just my experience as coming as a Canadian physiotherapist, which is a physical therapist, to the U.S. And then both Stefania and I did our credentialing and everything for the U.S. But in Canada, we don't have athletic trainers the way that there is in the U.S. So basically, physios in Canada are sport physios. You sort of specialize in that area, and you're the sideline person. You deal with emergent care. So here in the US with our team, we have athletic trainers who are very competent, and we have a big staff. So we each kind of define what our roles are and what our responsibilities are, and there's overlap, but we find our ways with the team that we have and the people we have to who's going to do what at what time. But I think as someone coming from the US to come and experience the way things work in Canada, for one thing, just understanding, learning different ways and, different things, good or bad, different, but also how sport physios are perceived and what they do is very interesting, because I think our scope is just naturally much bigger because there's no one else doing, the areas that are sort of split up in the US. So that's another interesting thing for someone coming from the US, I think.
If people prefer and want to email me or have a Zoom call one-on-one, I find adult learners, it's easier to have a discussion in person, so you know exactly the product that you're signing up for, that it's a good fit for you, or any nuances if you are an international applicant. Happy to connect one-on-one. I'm pretty easy to get a hold of. So, and I think my email was on that last slide as well. So great.
Thanks.
Thanks everyone for their time.